My name is Manendra. Together, me and Professor Indang from Universitas Indonesia will present our paper titled Preparedness of Dentists in Indonesia Towards COVID-19 Preventive Measures. COVID-19 is a serious and infectious disease caused by the SARS-CoV-2 virus. It is spread mainly through salivary droplets, aerosols, and contaminated surfaces. Dental treatments have a very high risk of COVID-19 transmission because plenty of aerosols are generated through the use of high-speed handpieces during treatment. Based on the data from Indonesia's Dentist Association from March 2020 until July 2021, over 300 dentists in Indonesia were reported to be infected by COVID-19, with 79 reported deaths. As a response towards COVID-19, Indonesia's Dentist Association have issued COVID-19 prevention guidelines for dental settings. Dental treatments are very important, especially for the Indonesian society in which the prevalence of people with dental and oral problems is high, 57.6% based on the most recent national survey. Therefore, it is crucial to implement strict COVID-19 prevention protocols to reduce the risk of COVID-19 transmission during dental treatment. The study aims to analyze the preparedness of dentists in Indonesia towards these COVID-19 preventive measures. Various studies regarding this topic have been done in other countries, but only a few have been done in Indonesia. So in the study, an analysis of factors that can have an association with dentist preparedness is made, namely the dentist perception, their type of treatment facility, qualification, work experience, number of patients treated in a day, and also history of COVID-19 transmission. So the study used a cross-sectional design. Data was taken with an online questionnaire via Google Forms from April to June 2021, and a total of 520 samples were obtained from dentists all over Indonesia. The questionnaire was mainly adapted based on the pre-tested and validated questionnaires regarding dentist COVID-19 preventive measures by Al-Khalifa et al., Amar et al., and Singh et al. So for this study, a pilot study was done on 25 dentists in which a Cronbach alpha value of 0.87 was obtained for perception and a value of 0.88 was obtained for preparedness, indicating good internal consistency. So this is the first part of our questionnaire in which we asked the respondent characteristics as mentioned earlier, regarding age, gender, where they practice, and everything else. For the second part, we asked about perception. So we asked three initial questions regarding their perception towards COVID-19 as a whole, in which we asked whether they think COVID-19 is a dangerous and serious disease, whether they think it is important to continually update their knowledge regarding infection control towards COVID-19, and whether they think that dentists have an important role in providing education regarding the prevention of COVID. While for the following numbers, so from number 4 to 21 of the second part of the perception, and also for number 1 to 18, so basically all the questions for the routine, we asked the same thing. So for example, in number 1 of the routine, we asked, how routinely do you implement a workflow for COVID-19 patient screening and management? And here, in the perception, we also ask how important it is according to them regarding the implementation of a workflow for COVID-19 patient screening and management. And their answers are given into in a 1 until 5 Likert scale, in which 5 means important, very important, sorry, for perception, and 5 for routine means always. And if they answered 1 for perception, it means not important, and if they answered 1 for routine, it means they never do it. So these are the questions asked. For each preparedness aspect, the respondent was considered to have a good preparedness if they answered a minimum of 4. And for the total scores for perception and preparedness, we made a categorization into 2 categories. And for perception, if the respondent had a total score of 84 or more, so on average answered a minimum of 4 for all the questions, they were considered to have a good perception. Same goes for preparedness. If they answered a minimum of 4 for all the 18 questions regarding preparedness, they were considered to have a good preparedness. If they, on average, answered a minimum of 4. After categorization, association between preparedness and each independent variable was analyzed with bivariate logistic regression, and after bivariate regression, multivariate logistic regression was done to analyze the adjusted odds ratio, which these are the most this is the most important odds ratio that we want to see. So adjusted odds ratio means the association of preparedness with each independent variable after adjustment with the other independent variables. These are the results of our study. The respondent characteristics were as follows, in which most of the respondents were female, worked in private dental clinics, qualified as a general practitioner, treated a maximum of 5 patients in a day, and even though like 88% were never transmitted by COVID, but quite a sizable percentage, around 11%, have been transmitted by COVID-19. And for perception, majority have a good perception, 96%. So these are the main results for each preparedness measure or preventive measure. So the measures which have the lowest proportion of dentists with good preparedness, or you could say the measures which are the most lacking here, as you can see, are regarding the offering of teledentistry services with 38%, provision of an isolation area per suspected COVID-19 patient, 32%, performing treatment in airborne infection isolation rooms with only 52%, and you could see also the others here, yeah. Routinely performing disinfection with no-touch disinfection technology, 62%, offering proper COVID-19 management training for staff in the clinic, 63%, using high-volume evacuator suctions during treatment, 59%, and using rubber dams on patients, only around 23%. So this one is the association of various variables with preparedness, and the three variables which are found to have a significant association with preparedness are perception, age, and also the type of treatment facility. So in this study, 4.2% respondents had a history of being transmitted with COVID-19 in their clinic. This shows that COVID-19 transmission during dental practice is evident. And only 45% of these respondents had a history who had a history of COVID-19 transmission in the clinic were found to have good preparedness. Same goes for the other groups, in which only 56 and 61% have a good preparedness. So this is actually quite worrying, because it means that quite a lot of respondents still don't have good preparedness. So both respondents who have been transmitted by COVID-19 and who have never been transmitted all still have a risk of getting transmitted in the future, including the ones who have been transmitted, because studies shown that COVID-19 reinfection can happen. Therefore, it is crucial for dentists to have good and consistent preparedness towards COVID-19 preventive measures, including in their clinic. Overall analysis showed that perception had a positive association. This indicates the importance for dental professional association across Southeast Asia to continually educate and increase awareness for dentists, so that all dentists can have a positive attitude and perception towards all these COVID-19 preventive measures. However, it is very important to note that a sizable percentage of respondents who have a good perception, 42%, also have poor preparedness. You could see in here. This indicates that a lot of dentists might have a positive attitude towards various COVID-19 preventive measures, but perhaps are unable to routinely carry out these measures due to other factors, such as the limited resources that they have for COVID-19 prevention, or the lack of skills or knowledge needed to perform these COVID-19 preventive measures. You could see, for example, also in the association of age towards preparedness. Yeah, respondents which are age older are more likely to have are less likely to have good preparedness compared to younger respondents. This might be due to the higher familiarity of younger dentists towards digital online platforms or technologies, which are a source of information and learning regarding COVID-19 transmission and its preventive measures. This indicates the need for higher attention towards dentists of older ages to be provided training and education regarding various COVID-19 preventive measures, which in turn can improve their routine or preparedness towards it. I think also a very important variable which was found in this study was the type of treatment facility, in which respondents that work in hospitals were found to be more likely to have a good preparedness compared to respondents that work in primary healthcare centers. This difference is most likely caused by the limitations of resources required for COVID-19 preventive measures in these facilities, primary healthcare centers and private clinics, compared to hospitals. Limited resources can cause dentists difficulty to routinely carry out various COVID-19 preventive measures. Therefore, it is very important as a solution that training and education by dentists, professional organizations across Southeast Asia on how to implement various COVID-19 preventive measures. It is very important for that training to be given, because especially for the measures which are still lacking, as mentioned earlier. Constant training can help increase the awareness and skills of dentists to perform various COVID-19 preventive measures. And specifically, training can increase dentists' skills in carrying out measures which they can't routinely do because maybe they can find it hard to do so. And bigger attention needs to be given for older dentists and dentists working in primary healthcare centers. Besides training, it's also important for stakeholders to work together to provide various resources needed for COVID-19 prevention if these resources are still lacking. Governments, for example, can work to subsidize various treatment facilities with sources needed for COVID-19 preventive measures, especially the ones which are still limited. Okay, that's all from us. Thank you.